The intracranial space is a view that we're going to be looking at quite often because you can not only recognize many of the cranial bones that we discussed in the anterior, lateral, and posterior views, but also many of the foramina or openings for our cranial nerves as well as blood vessels. Okay? So again, this is going to be your anterior aspect here, the frontal bone. This is posterior, the occipital. Okay? So the frontal bone, we can appreciate this sort of dimpled location just above the eye orbit. So to actually access the orbit, this portion of the frontal, it's very thin, it has to be chiseled away. And that's where you'll see your extraocular muscles, your eyeball, associated vasculature. In between your frontal bones, we can appreciate a portion of the ethmoid bone. There is a little projection, it looks sort of like a shark fin. Okay? It's called the cristagalli. And then surrounding it, we have the cribriform plate. And the cribriform plate is really important because it's going to transmit sensory nerve fibers from cranial nerve 1, the olfactory nerve, into the nasal cavity. Okay? And that's, of course, responsible for olfaction or a sense of smell. So this sort of anterior portion here is referred to as the anterior cranial fossa. Okay? So it's sort of like a staircase. Okay? We have the first step, which is the anterior cranial fossa. Then we transition to the middle cranial fossa. And as a part of that, we can appreciate the sphenoid bone here, which again is a butterfly-shaped bone, has a lot of foramina, a lot of openings for our vessels and our nerves, okay? As well as our temporal bone. So we saw the temporal bone laterally. In the intracranial space, this portion is called the petrous portion, which literally means rock. So it's very dense. It actually has really good survivability if we have a forensic case because of how dense that bone is. However, it does have a lot of porosity because we do have structures that pass through here as well as the structures of our inner ear are contained within that petrous portion. Okay. So that's our middle cranial fossa or that mid step. Continuing posteriorly, we have the occipital bone, okay? And we can appreciate a really large opening. It's the greatest or largest foramina in our body. It's called the foramen magnum, which literally means great hole in Latin. And that's where our spinal cord is going to transition out from that intracranial space. We can also appreciate the depressions that are created by our dural venous sinuses that help to drain the brain of blood.